All right, so now coming to the strengths of CPT. CPT is a gold standard therapy for trauma because, as we're aware, it is quite structured, it is time limited and research backed. Um, it also provides both clarity and direction, especially for our clients, right? Because after experiencing something chaotic, something traumatic, um, our clients do seek clarity, a sense of direction, and that is what you provide to them through CBT. It also directly targets the meaning of trauma. All right, it's not just targeting the memories; it's targeting the meaning of trauma. Clients at the same time are leaving with practical tools they can apply long after therapy ends. All right, something that is sustainable and long lasting for them. CPT also helps reduce trauma related guilt, shame, and avoidance. Um, and as we discussed previously as well, um, these emotions here of guilt, shame, and avoidance is very common in somebody who is a trauma survivor. All right, so CPT helps to reduce that. And as a consequence, we are also helping the client feel unstuck from their past. All right. Okay, we move forward. Now, coming to the limitations. All right, it's very important to note that CPT is not for everyone and is not for every situation that you encounter as a clinician, as a psychologist. All right. Um, CPT asks the clients to face distressing memories and thoughts. That's a given. All right. Um, and as a result, as a consequence, that can really increase emotional discomfort in clients. All right. So as you can see, the first pointer here on the screen as well, it really requires for the client to face their traumatic thoughts, their traumatic memories head on. It is also very homework heavy. It requires a lot of consistency between sessions, something that is common with a lot of cognitive therapies there. We do make use of a lot of homework. All right. Also, another pointer here towards the third, the third pointer here on the screen, is that in cases of severe dissociation, all right, if there's severe dissociation or if there is cognitive impairment, um, you might need to proceed with adaptation or stabilization first before coming to um, you know the techniques and CPD work. I hope this makes sense. All right, so help the client adapt, help them stabilize. Now, how can you help them stabilize? You can make use of grounding, you can make use of emotional regulation techniques. All right, so depending on the client, their presenting concerns, and the clinical picture, all right, you make the call. But just because we have some things here to keep in mind doesn't mean that CPT is not effective for trauma work when implemented right. CPT can really produce enduring, transformative changes, and that's a fact. All right, move ahead. So now we have a quick case study for you guys. It's on Anjali. Anjali here was involved in a serious car accident where her close friend was badly injured. She immediately, as a result, started blaming herself. She started thinking that it was my fault she suffered. She started blaming herself for the accident. Now, this belief of Anjali, all right, you can see on the screen as well, this belief started affecting her mood, her self esteem, and her daily functioning. All right. So, when I say daily functioning, she also started avoiding driving. She started withdrawing socially and started carrying intense guilt with her around the clock. So with CPT, right, in CPT, as clinicians ourselves, we will first identify this as a stuck point. All right, if you can see on the screen, um, I failed. It's my fault she suffered. The second pointer here. We would identify this as a stuck point here. All right. And we discussed, stuck points previously as well. A stuck point is any rigid belief that blocks recovery, makes the client feel stuck in the past. Now, with the client, you are going to be writing an impact statement. We discussed impact statement in the tool slide as well. Uh, an impact statement helps the client describe the accident and what it meant to them in their own words. All right, so any impact statement would include detailed, um, you know, description of the event and what it means to the client. The purpose of impact statement here is to also externalize the thought and view it more objectively. All right, so that is how it helps us in therapy as well. After the impact statement, as a clinician, we are going to next move to challenging beliefs worksheets. We discussed this in the tools section as well. A challenging beliefs worksheet, as the name suggests, is used to test a thought. All right. Um, so, along with the client, we are going to be examining the evidence around her thoughts, around her stuck point. So, after examining the evidence, for example, all right, we will recognize that there is a prevalence, there's a pattern of a cognitive distortion of personalization, all right, where she is taking responsibility for outcomes beyond her control, for example, right? So that is a conclusion we'll draw after using um, assessment systematically, after using, for example, challenging beliefs worksheets or impact statements, to conclude that there is a presence, there's a prevalence of a pattern of cognitive distortion at the same time. Over time in therapy, Anjali can learn to reframe her beliefs to I did all I could. All right, if you can see on the screen from the second pointer here, I failed, it's my fault she suffered, to I did all I could, and that will be an ideal response for us. Now, the homework exercises that we will be giving to the client in between sessions would help reinforce this thinking, um, and would really help Anjali here, the client here, note her resilience and also the helpful actions and the supportive responses that she's been receiving from others. All right, so it's again a very important, it becomes a very important thing then to reflect on one's journey and to consolidate the learning from the session to our real lives. Over time, clinically, this process, these intervention techniques would then help process um, guilt for the client, right? It will help bring emotional shifts, as we discussed earlier, from perhaps shame to sadness. All right, so that is something that is ideal for us. The client may also re-engage socially and emotionally and even may resume driving. All right, so that is again a positive consequence for us. All right, so CPT here in totality, if I summarize, is a very transformative tool, is a way to work with the client's emotions, behaviors, their cognition, of course, to support them on a sustainable trauma recovery, of a journey that they're on. All right. So again, a very effective, a very efficient tool that you can, take up to work with trauma. All right. Now to sum up, trauma, as we discussed, often leaves behind beliefs like it's my fault or I'm not worthy. All right. These are very common beliefs that are present in trauma survivors. Now, the presence of these beliefs, right, can really hurt one's self esteem and emotional well being, can maintain their emotional pain. All right. CPT would then help to identify, help to challenge and replace these interpretations with balanced meaning. All right. Um, and as the beliefs start to change within the client, um, the emotional shift would be very, very, visible. But at the same time, the client's self worth will also begin to heal. Very important here. Towards the end, I have a little reminder for all of us to take away is that we can't always control what happens to us. All right, but we can change the meaning we give to it. Again, very essential to the work we're doing here. All right. Another reminder for us as psychologists, um, as somebody who's in this field, um, the story clients tell themselves matters more than the event itself. All right. We can't control what happens, but we can always influence the meaning we assign to it. All right. So, as a clinician, even as the client themselves, we can't control what has happened in the past, but we can always continue to influence the meaning we are assigning to it. All right, I hope this makes sense. Pretty important as a reminder. All right. So coming up, we have the full CPT training, the full comprehensive training, which will be happening in the coming few weeks. Um, so now the complete CPT training here takes whatever you've learned today from this training, from this introductory training, and it will turn into a hands-on, clinically grounded skill set. All right. Each section, as I'll discuss in a few minutes as well, each section, each module is very carefully crafted for you guys. It's very progressive in nature, and we are not just aiming here to teach you about the concepts, but we're also going to be very heavily focusing on how to show them to you, how to show you how to use them within the session, within the training. All right, the first module here that we'll be covering is on introduction to CPT and cognitive work. You will be gaining a clear understanding of how trauma shapes thinking patterns and how to use these thoughts, right? And how to use trauma. Um, I'm sorry, just give me a second. Yes, I'm sorry. So you will be getting a very in-depth understanding on how to use the model we discussed previously, if you remember. We move from thoughts to emotions to behavior. All right, so we'll be learning how to use that model in real life with real life client cases. All right. Now, this foundation that we'll be covering in module one will help us to, um, explain the process. All right, the CPT process to clients in real life with real, simple, empowering terms. All right. The second module here is on trauma, stuck points, and core belief themes. Here you will be learning how to identify reoccurring patterns. All right, we just discussed 5 trauma themes on safety, trust, control, esteem, and self-esteem, and intimacy. All right, so you learn how to identify reoccurring patterns across these 5 themes. Um, this module here will also help to pinpoint where the clients are feeling stuck. Very important. How to identify where the clients are and where exactly are they feeling stuck in regards to their traumatic event. Again, this understanding would help you to tailor your interventions accordingly in the future. All right. The third module here is on common cognitive distortions in trauma work. So in this module here, we'll be giving you examples, and really working through guided reflection, where you'll see how distortions like I'm responsible for everything that went wrong, or no one can be trusted, can very subtly operate in clients' narratives. All right, so we'll see how we'll see how all of this is influencing the clients' narratives. Yeah, you'll also be practicing how to name them and challenge them more effectively. All right. The next module here is on tools and worksheets for CPT practice. Here you will be learning the step-by-step guide on how to use CPT structured tools that we've already covered previously. All right. So there are a lot of tools in CPT, from writing exercises to evidence testing to belief tracking. All right. So we're making use of a lot of tools to assess all of these, and we'll be practicing them within the session as well. The next module is on reflective questions. And as we've discussed previously as well, you'll be given 100 plus prompts to guide clients. All right, you'll receive a ready-to-use resource bank organized by trauma themes. There are 5 trauma themes, and according to those themes, you'll be receiving a resource bank, um, which will be very ready to use in your sessions. This will enable you to guide conversations, encourage journaling, and deepen insight without searching for the right questions in sessions, of course. Something that will be very beneficial for you. The next module is on application and role play for real clinical use. So here we will be making use of interactive role plays and case examples. All right, so we'll be making use of a lot of case examples to help you practice applying whatever you've learned. All right, help you practice applying CPT tools as well, in realistic scenarios, in real life scenarios. All right, so it will help you gain confidence as a clinician, as a psychologist, um, and would help you to master these techniques here. The last thing we have here is called as summary integration and next steps. So towards the end, finally, we'll be integrating, we'll be consolidating all our learning from the workshop into a very cohesive, framework that will be easy to understand and use even beyond the workshop. And hopefully, by the end of the training, the comprehensive training, you won't just know about CPT and what it is, all right? You'll be ready to practice it as well, something which is very important. Okay. So with the comprehensive training, you will also be receiving exclusive takeaways, all right? As we talked about, there's going to be a very comprehensive CPT ebook with all the theories, tools, and case examples. Um, um, there'll also be handouts and worksheets that you can use with your clients readily. There'll be 100 plus reflective questions that we organized by 5 trauma themes. There'll also be flowcharts and visual aids that'll help you simplify CPT process. And upon the conclusion of the full training, a certificate of completion would be given to you. All right, so a lot of takeaways, a lot to gain from this comprehensive training. This here is the sample certificate that we issue to you once the comprehensive training concludes. All right. So let's just take one example from the reflective question toolkit that we'll be providing to you. Um, so the theme I've taken here is on trust. So there are 5 themes, and the one I've taken and chosen here is trust. All right, so this here, the first pointer here is the example, the sample question here. All right, and goes something like this: who in your life has shown they can be trusted even in small ways? All right, so this question here, this guided question here, this reflective question here, it seems quite simple, all right, uh, but it can help open, um, profound emotional understanding, insight, and reflection for the client. All right, because what happens is, for a lot of trauma survivors, trust as a concept becomes very black and white for them. So they usually think like, nobody can be trusted, no one can be trusted. So when you use guided questions like this, when you use reflective questions like this, of course, sorted in different themes within your sessions, um, it'll help the clients find exceptions to that belief that they have. All right, and what that will do next is it will create a small but a powerful shift in their understanding of their worldview, of the world around them and how they perceive it. And that's what we want as clinicians, right? It will also encourage the clients to notice any subtle evidence of, for example, since we're exploring the theme of trust here, uh, the client would be encouraged to explore and notice any evidence of safety in their environment that pre-exists. All right, maybe it's a friend who always replies to them. Maybe it's a colleague who respects their boundaries, um, or even if it's a pet, that they can rely on for affection, right? So stuff like that, little things, little subtle things that they can notice, and enough of these reflections within the sessions would lead to um, them overcoming their general mistrust of the world and everybody around them. All right, and it will really invite the clients to consider that maybe what, maybe trust is not something that has to be all or nothing. Maybe it doesn't have to be that concrete, that absolute. I hope this makes sense. So this here, if you can see on the screen, this question here is just one example, just one reflective question that can lead to serious reflection, serious exploration, and insight development. Through the CPT training, the comprehensive CPT training, you will be receiving a bank of over 100 plus reflective questions. All right, and these questions here would be grouped in 5 themes, under 5 themes, which are safety, control, guilt, self-esteem, and intimacy. Right, and as we discussed, these all are core beliefs that are affected by the traumatic event. And once you have access to these 100 plus questions, for example, right, you as a clinician, you as a psychologist would never feel stuck in sessions. All right, you'll have these ready prompts that you can use that will fit different, client presentations and, different therapy stages, for example. All right, so this is a resource that will be very valuable to you in the long term, and something that you can return to again and again. All right, I hope this makes sense. Pretty important. All right, move ahead. So now coming to why this training matters. This training here is not just about learning a set protocol, for example, or some, rules and techniques, right? Um, it's about learning to guide people through the reconstruction of meaning after trauma, and the reconstruction of meaning that people assign to their traumatic events is what we're trying to achieve here. All right. So, for example, when someone says to you, "I'll never be the same again," CPT would then help us to respond um, that, you know what, you may not be the same again, and that's understandable, but you can still be whole. So, reconstruction is what we're trying to aim for here. And CPT helps us to do that, right? It helps bridge science and humanity. It helps us to proceed in a structured way in our sessions. It helps provide clarity, compassion, and the possibility to change with the clients. All right. And professionally, for you, this training can really help you to deepen your trauma understanding, your trauma competency, very important. It would also help you to expand your clinical vocabulary with uh, all the structured tools that we discussed so far. And not to mention, um, it will really help you to build confidence in navigating complex trauma narratives, which is something that you will be encountering as psychologists. So, in short, if I summarize, um, CPT, this training, this comprehensive training on CPT, um, is not just going to be transformative for the clients, for your clients, right? It's going to be very transformative um, for you as a therapist as well, right? So, a lot to learn and a lot to take away from this comprehensive training here. All right. Okay, then. Thank you so much for joining today. Thank you so much for being a part of today's introductory mini training with MindTribe. I really hope that this session today has given you insights, um, insights into how you can immediately start to apply whatever you've learned today in your sessions. All right. Um, Apart from this, um, we do have, as I told you, we do have a very comprehensive training, the full CPT training, coming up for us. It will be a 6 to 7 uh, hours long, and it will be full of interactions, applied learning, and it will be complete with demos, reflective practice, and client-ready tools. Right, so a lot to learn, a lot to gain. It's currently priced at $499. And if you ask me, it's a small investment that you make for a lifelong skill set that you'll be, gaining through this training. And apart from the training, you'll also be receiving a CPT ebook, as we discussed, a toolkit of 100 plus reflective questions, worksheets, flowcharts, and session templates. You'll also be receiving a certificate of completion uh, to add to your credentials once the workshop concludes. All right, then, thank you all for joining in. Thank you for your time, thank you for your attention, and your clinical curiosity. We've had a lovely time having you all here. And on behalf of the MindTribe team, um, please keep learning, please keep evolving, and we'll see you soon. Thank you for being here.